Welcome guys, Paul Kolaski, Vallejo PT, Vallejo PT Online. I'm going to talk to you guys today about a subscapularis release technique using a single lacrosse ball. Muscle that's right under the shoulder blade oftentimes gives us grief or limits us when we're reaching out into the external rotation position. Reaching up and back are going to be the most common times when this muscle gets tight and is kind of hyperactive. Lacrosse ball, if we think about just coming right off of the armpit and dropping straight below, so right from the armpit, drop straight down, right up against the wall. All right, that's how we're going to find that muscle the easiest way. Small circles, up and down a little bit. You can take it all the way up as high as into that armpit a little bit. You guys can see that there. Looking for any spot that's sore, tender. Not really going to stop on anything right this second. We're just stimulating that area in 20-30 seconds. I got a little spot right there. I'm gonna work through it a little bit. Not gonna stop and hold. All right, just gonna work right over top of it. All right, get a little bit lower, so that muscle goes all the way down to the bottom of the shoulder blade. All right, so time on task here again, 20 to 30 seconds, stimulating that area. As soon as we come off of that area, typically the activation that we want to do directly after that's going to be an external rotation move. We can use the wall and do it isometrically. You can use your opposite hand. So basically up nice and tall, good posture. We're going to work on moving the hand out. Elbow stays by the side. So if I want to use my opposite hand, I can put light pressure there. Hold 1, 2, 3, relax. Use the wall. All right, again, I can press out to the side and relax. With the wall, I just want to just barely cause myself to shift away. Barely cause myself to shift away. If I have access to some stretchy bands, all right, so I'm gonna switch arms just for the external rotation. All right, so right here again, elbow down by my side, up nice and tall, and I'm gonna move my hand out to the side. All right, all of those are reps are gonna be 10 reps, building up to 20, and then you're gonna repeat that whole series twice. Okay, so coming out to the side, we'll do 10 reps, full range of motion. I'm shortening this up a little bit, so my arm should be starting across my body and then coming out to the side. Boom. Boom. All right, so that's going to be that shoulder external rotation. Again, I switched sides so you can see my shoulder. Make sure you do it on the opposite, the same side that you did the ball work on. All right, coming off of that, the integration technique that we want to do is actually called a bent over or a prone T movement. All right, I'm going to reset the camera to catch it. All right, so we just completed the subscapularis release technique or stimulation technique using a lacrosse ball. We activated the external rotator muscles of the rotator cuff, all right, which would directly, reciprocally inhibit that particular muscle, that subscap. Now we're going to integrate that muscle into a functional movement pattern. All right, so the way we're going to do that, you have two choices. You can do the bent over T or the prone T. Only difference there is that you have a table that you can use or a bed. The other, you're using a chair. So if I'm just doing the bent over, I got my table set up. I'm going to not use that for right this second. So if I'm going for the bent over T, again, I showed you the ball technique on my left arm, but let's say my right arm is I don't want to turn around the back side of the camera. So show that technique with my right arm. You're in an offset stance. You want your trunk to get parallel to the ground. That's the key here. Arm is hanging down hanging straight down to the ground. Hand is in a neutral position, meaning that palm is facing inward. Okay, right here in that position, what we're going to do then is just reach out to the side. This particular motion of the T, guys, is going to vary person to person and based on your thoracic spine. Okay, we're not trying to get way up here. Okay, we're not trying to do that. All right, we're just trying to activate that muscle. Should be pain-free. All right, working to the range of motion. Should be just optimal, should be just a little below, either right at parallel to the ground or a little below. All right, so this would be the bent over position. If I've got the option to use a table or my bed or whatever other couch. All right, so hang an arm off the side, so now I'm in the prone position, laying face down. Same motion. All right, coming right out, straight out to the side. Make sure that the shoulder's not shrugging during that movement. Keep it pain-free, nice and easy. Reps here, 10 reps, working up to 20. As soon as you get down doing that first round of T's, you're going to go right back to the ball on the wall. Another 20 to 30 seconds of ball on the wall, followed by that external rotation activation, followed by another 10 to 20 of these T's. Alrighty? Got any questions, guys? Hit us up. So that is the most common correction that we see for individuals with subscap tightness. All right, so again, got any questions, feel free to reach out. Paul Kowalski, Vallejo PT online, and we'll see you next time. Have a great one.